good morning friends. Today we are showing you a case in this video of gangrene of the left big toe and one more toe, that is the fourth toe of the left foot. The patient came to us about 1 month ago with the blackening of the fingers, both the fingers I mentioned, and gradually it is getting worse and almost impending gangrene. Now we started our regenerative medicine with the application of growth factors as well as HPOT therapy and infrared and laser treatment. We have standardized the protocol of regenerative therapy. Now if you look at this wound, when the patient came, it had returned completely black right up to the base of the big toe till the MTP joint. This is metatarsophalangeal joint. The entire finger had turned black, blackish in color, suggesting impending gangrene. And this is for the other toe, the fourth toe, which you are able to see now in the close-up, had completely necrosed surface with a visible bone and also heading for impending gangrene. So now we took this patient from that situation forward by regular application of growth factors, and today what you are seeing is almost 3/4 of the finger, this big toe is salvaged, and you are seeing a very good line of cleavage line. You are seeing the red granulation tissue, and whatever the portion beyond this is a whitish material which is going to slough off, but the blackness has completely disappeared with the effect of the growth factors that we had applied. Regenerative practice is working. Hello, good morning friends. Today we are showing in this video a continuation of a video we did a few days ago. This is about the gangrenous big toe that had a very bad picture to begin with, and it was almost there was a possibility of a disarticulation from the MTP joint, which we resisted, and we treated it as against the conventional method of management with the regenerative protocols, wherein we don't do any debridement and we try to regenerate the existing tissue by optimizing the local healing conditions, as well as with the support of our the spectrum of regenerative treatment protocol, which involves the application of infrared, laser and HPOT, along with the application of the growth factors, stem cell derived factors. So ultimately culminating in the picture where you are seeing 70% of the big toe is salvaged, and you can see the metatarsophalangeal joint here and the first interphalangeal joint here. Until then, till that point, the wound is the toe is survived, and the very good vascularity has developed at the cleavage line, which you can see being developed very clearly with the gradual separation of the distal portion, which is of doubtful viability. But even then, we are now doing any debridement. We are allowing it to separate by itself, taking meanwhile precautions to see that no infection takes place. And this is the standard protocol in our regenerative medicine as against the conventional methods, where debridement, wielding the knife, seems to be the practice with most wound care givers. As against that, we try to exercise restraint as far as debridement is concerned, because the interface between the viable and the non-viable tissue is not a very clear-cut demarcation. There is always overlap, and what we presumably think that is non-viable tissue, and we overstep, and always we end up cutting off the fighting zone of the body where the defense mechanism is concentrated. So this is the major difference in the conventional methods and our regenerative methods, which I want the viewers to highlight upon, and which explains the surprisingly, the remarkably good results that we get. We have managed to salvage apparently wounds which have been forsaken and subjected to radical debridement. So you will probably get the closure video of this continuation, the final video in this series in the next few days when the wound is separated completely, granulated and completely epithelialized. Thank you.